Hi, employees of Cain Construction. My name is Allie Tom, and I am the broker for Cain Construction. And today we are going to go over the open enrollment benefits that start February 1st. If you guys would like to make any changes to your plan, you guys have until the 15th of February to make any changes. If you're not making any changes, nothing is required from you. But today we're going to go over some of the benefits that you guys have with the health insurance and some reminders for you guys. So this year, Cain Construction will stay with Aetna for the health insurance and Guardian for the dental, vision, and life. Employees, you can add spouses and children to the plan effective February 1st. Employees, you can also remove children and spouses effective February 1st. And we're going to go over some of that here on the next slide. So this year, there are ways for you guys to save on your health insurance. It's always important to try to find the most affordable solutions to you guys. And some ways to do that is shopping for prescriptions online and specifically using goodrx.com. So if any of you guys are on a prescription medication, a maintenance medication, or your doctor prescribes you something this year, you can go on to goodrx.com and shop out your medications. And on GoodRx, it will show you the cheapest, most affordable place for you to find your prescription. It has coupons available on there. You can compare prices, find free coupons, and save up to 80% on your prescription medications. So for the employees that are on the HSA plan, this is a great way for you guys to shop out your medications and save some money. Another thing that you guys have available to you, and if you elect the HSA plan, this is for the HSA plan only, and I highly recommend it, you guys can set up an HSA account. An HSA account allows you to put tax-free money away to help pay for your medical expenses. You can contribute to your HSA account via a payroll deduction, online banking transfer, or by sending a personal check into HSA Bank. You can pay for any qualified medical expenses with this account. So every dollar that you put away, it can help you pay for things such as prescriptions, doctor's visits, any claims that you have, dental needs, vision needs, chiropractic care. It's really a broad spectrum that you can use your HSA account for. Now, it's really important to remember not to use your HSA account for non-qualified medical expenses, and I'm going to go over that here in a second. So HSA helps you save on taxes. So for every dollar that you deposit into your HSA account, you save 30 cents. So for example, if you want to deposit $20 into your HSA account each paycheck, you will save $6 in taxes. So throughout the year, this account can help you save hundreds of dollars in taxes. That's why you guys can't use it for non-qualified medical expenses, because you are putting this in tax deferred for qualified medical expenses. If you use this for anything else, you guys are going to pay the penalty for paying for something outside of the health insurance realm because of the tax discount that you're getting. This account is yours to keep even if you leave your job with Cain Construction, and the money rolls over year to year, so you don't lose it if you don't use it. The contribution limit for an individual is $3,600, and for a family, it's $7,200 for the year. Part of your guys' health insurance that you have with Aetna is you have something called telemedicine. Telemedicine is a Skype with a doctor, so you can either use your phone or your computer if you guys aren't feeling well. They can treat you online, and it requires no urgent care or no emergency room, so you can Skype with a doctor and you can go over any cold and flu symptoms, allergies, urinary tract infections, rashes, sinus problems. If you guys have any questions about coronavirus, if you think you have coronavirus, you can Skype with a doctor. It's a $40 copay or less. So it's a great service to use, because if you go into urgent care and you're on the HSA plan, you guys are going to be paying 100% for that visit out of pocket. So if you guys aren't feeling well, or if you have any spouses or children on the plan with you, they can use the service too. It's a $40 or less copay. It will help you save money from and by not going into urgent care. If you go into urgent care and you guys get tested for strep throat, or you think you have the cold or flu and you go into urgent care, your urgent care visit can be up to a couple of $100s. So this is a great way for you to save money. It's efficient, it's effective, and you guys don't have to leave the house to use it. So I really recommend you guys use telemedicine this year. Part of your health insurance that you guys have with Aetna is they have a healthy rewards program. And part of the program is that you guys can work towards getting an Apple Watch. If you already have an Apple Watch, then your rewards can go towards things like a gift card to Amazon, Target, Best Buy, CVS, those sort of things. How you guys get points is you have to download the Aetna Attain app, and then you can see on there that they'll have certain programs where you can get points. They have a steps program on there. A lot of you are in the construction industry, so you guys are on your feet all day. You're probably getting your 10,000 steps a day. So for every step you get, you're going to get a point towards this healthy rewards program, and you can build a benefit to help you pay for an Apple Watch or get those gift cards. They also have other things available to you, such as weight loss programs. If you want to quit smoking, they have guidance on how to quit smoking. So it's a really great app for you guys to become healthier, and not just become healthier, but get paid to participate in this program. So for the health insurance, you guys are going to have the same two plan options that were available to you last year. You guys have a $2,750, a $2,500 copay plan, or a $2,750 100% HSA plan. So the health insurance plan option one, I'm sorry, it says $2,500 at the top here. It's really a $2,750 deductible. And how this plan works is that you guys pay 100% of the cost until you reach this individual deductible of $2,750. Your preventative care is always going to be covered at 100%. You're going to see right here that you have under your prescriptions that it says deductible and then copays. So how this plan works is you have a $2,750 deductible. If you guys satisfy that, then you do have copays, and only copays for prescriptions. That's the only thing that you have copays for. So the only way to reach this out-of-pocket maximum of $3,450 is with copays for prescriptions. So a lot of you aren't going to have that this year. A lot of you guys are going to only reach this $2,750 deductible, and that will be the most you'll be exposed to this year. It's $5,500 if you have a family plan. It's a really great plan. Again, you can use this HSA plan, and you can open up an HSA account to help pay for any expenses you might have this year. It's a really great plan. I highly recommend it. I think it's a good one for you guys. The next insurance plan that you guys have available to you is a $2,500 copay plan. So you're going to see here on the copay plan, you guys have a primary care. So if you go in to see a primary care doctor, you have a $35 copay, a $70 copay to see a specialist. Preventative care is always going to be covered at 100%. You're going to see that you have a prescription copay of $3, $10, $45, $75, and up. This $3 copay is going to be for generic medications. This $10 and $45 copay is going to be for brand medications. The $75 copay is going to be for more expensive injectable medications. And this $500 is going to be for expensive injectable medications as well. Things like Humira are in this. They're really expensive drugs. This $45 and $75 that you see here, usually those are going to be the prescriptions that you see on TV. So they're going to be more expensive because these copays go towards their TV advertisements. So always talk to your doctor about getting prescribed a generic medication because it's going to be a lot less expensive for you. You're going to see that you have a $70 copay for urgent care, a $300 copay for the emergency room. And one thing I want to bring up on both of these plans is that you guys should always try to avoid going to the emergency room if it's not a true life or death emergency. And on this HSA plan that you'll see right here, you guys are going to be paying 100% of the cost for the emergency room until you hit this $2,750 deductible. And so any emergency room that you walk into, as soon as you walk in, you're going to reach this deductible because emergency rooms are incredibly expensive. So if you guys have anything that you need to get done, stitches, broken bones, x-rays, a lot of urgent cares can do that for you. So before you go to the emergency room, ask yourself if it's a true life or death threatening emergency. If it's not, please go to urgent care because you will save quite a bit of money by not going to the emergency room. This copay plan has a $2,500 deductible. And then once you reach that deductible, you're on 80-20 coinsurance, where Aetna's paying 80% of the bill, you're paying 20% of the bill, until you reach this out-of-pocket max of $6,000. So you'll see on the first plan, the HSA plan, you guys have a deductible of $2,750, and then you don't have any coinsurance. And the only extra thing you'll have to pay for to reach the out-of-pocket is copays. Excuse me. On the copay plan, you guys have an out-of-pocket max of $6,000. Meaning once you reach this, you could have additional needs that you'd need to pay for. Excuse me, sorry. All right, so next you guys have dental through Guardian. Nothing has changed with this plan this year. You guys still have a $50 copay for services. Your preventative care is covered at 100%. But basic care is covered at 80%, and major care is covered at 50%. On this plan, you're going to see that you have an annual maximum benefit of $1,000. On this page, you're going to see that under preventative care, things that are covered at 100% includes things such as oral exams, x-rays, fluoride treatments, that sort of thing. So going in for your annual exam will be covered at 100%. Basic care is covered at 80%. And what's covered under basic care are things such as fillings, repair and maintenance of crowns, bridges, and dentures, and anesthesia. And under major care, it's covered at 50%, and that's going to be for things such as root canal, periosurgery, endodontics, dental implants, some single crowns, extractions, that sort of thing. Part of what you guys have with Guardian on this page you'll see is a maximum rollover benefit. So a maximum rollover benefit, what that means is that if you guys go in at least once a year for an annual cleaning and you don't exceed claims over $500, then you're going to get a rollover in-network benefit of up to $350. So what that means for you guys, some of you went in last year for your annual cleaning and you guys didn't exceed a threshold of $500. So that means this year your guys' annual benefit is actually $1,350. This annual benefit covers expenses. So the expenses we saw over here, if you guys have to get fillings done, they're covered at 80%, but you're going to have this annual benefit of $1,000 to help you guys pay for services. So if you have any fillings done, this benefit's going to help pay for those fillings. So next year, if you guys go again in this year for your annual cleaning and you went in last year, next year your annual benefit's going to be $1,700 because you've gotten this $350 bonus 2 years in a row now. You guys also have a vision benefit provided to you. This is a really great vision benefit. If any of you have any vision needs, this is a really affordable plan for you guys to elect from. So you're going to see here that you have an exam copay of $10. And this is a really good eye exam. These vision exams usually cost a couple of $100. For you guys, if you go to an in-network DSP provider, it's a $10 copay to get a full vision exam. You're going to see that you have a materials copay of $25. What that means is if you order anything from the vision provider, any frames, then they're going to charge you a copay of $25. Now, I really recommend not ordering any of your materials from the vision provider because it's always going to be more expensive. If you guys have contact lenses or frames, I always suggest shopping those out. If you have contact lenses, you should shop those out on 1-800-CONTACTS because you guys will be able to use your vision insurance to pay for a year's supply of contact lenses. And if you guys have any frame needs, I highly recommend going to any CVS store or Costco, Walmart, those types of places. Have a vision store there that you can buy your frames from, and this benefit will pay for that. You guys get a benefit of up to $130 on this vision plan. So you get $130 that can either go towards contact lenses or a new pair of frames. You have to pick one or the other. You can't get $130 for lenses and frames. It's just for either lenses or frames. So you need to pick which one you want to use that benefit for. The contact lens benefit renews every year, so you get $130 every year for contact lenses. And if you guys decide to use it for frames, you get $130 every 2 years. It's a great vision program. I highly recommend it if you have any vision needs. You guys also have a $10,000 life insurance policy through Cain Construction. So this would help pay, it's a $10,000 benefit, and it would help pay any final expenses for you. Any funeral expenses, maybe any debt that you left behind. This can help give your family a $10,000 benefit to help with your final costs. It's a really great benefit that they have for you guys, and it's nice that they offer it for you. So again, it's a $10,000 benefit. Another thing that you guys have with Guardian is an employee assistance program. An employee assistance program gives you and your family members access to personal support. Anything from mental health, stress management, nutrition, to handling legal or financial issues. This is a free support program that you guys can use anytime you need. Services include consultations with experts, as well as access to resources and discounts designed to help you in a variety of ways. So if you guys have any mental health issues going on, any of your dependents can use this too. If anyone in your household has any mental health issues going on, this is a great resource for them to use. You can have free telephonic service, counseling services. If they think you need to go in and see a local provider, they will refer you into a mental health provider for 3 free visits. If you guys have any questions with your taxes, they can help answer your questions around taxes. So it's a free program for you to use, and it's really excellent, and it can help you with a lot of different things. If you guys have any questions, you can reach out to myself, Beth here at our office, or Sam. Nothing is needed from you if you want to renew your current plans. If you would like to make changes, please inform Sam no later than February 15th. If you would like to add dependents, please ask Sam for an application to add them to your plan. My contact is listed here. I'm Allie. Beth in our office is a great resource. Her phone number is listed here. These are our emails. You guys can call us, text us, email us. We're here to help you through anything that you might have. So please let us know if you have anything that you need. Thank you.